want to thank you all for coming to our vigil tonight. It's amazingly exciting to see so many people here. I also want to thank our co-sponsors for the event, Democracy for America, True Majority, the Center for Community Change, Doctors for America, Healthcare for America Now, and the Service Employees International Union. So you'll see there are people with red hats that are drifting around, and there are greeters. And we're trying to get as many people signed in as we can so we can get a really accurate count so we can inform the media how many great people were here. So please, if you see somebody, try to give them your name and everything. This is one of nearly 300 we can't afford to wait vigils around the country that are happening right now. Tens of thousands of Americans are taking action today because we're at an incredibly crucial moment in the fight for real healthcare reform. We're also gathering here today at a moment of profound sadness for all Americans in the wake of Senator Ted Kennedy's passing last week. Almost 40 years ago, Ted Kennedy introduced his first bill to provide healthcare for all Americans. And this year he introduced his last. So tonight, let's remember Senator Kennedy's powerful words about the need for real health care reform.
But it brings me back, my friends, to another thought, and that is the whole issue of health insurance and universal coverage. It has been the passion of my life. It has been the passion of my life. And it has been the passion of my life since the earliest days of my life, when we have been exposed to cysto and mental retardation, and we saw the special kinds of care that she needed, and the attention that she took. 7 months in a hospital after a plane crash. 3 children, 2 of which have had cancer of the lungs. A son who lost a leg to cancer is a young child. I was exposed to really the challenges of healthcare, and I was always also exposed to the very best in healthcare. And one of the searing memories in my life is being in a children's hospital in Boston with my son, who had lost his leg to cancer. And he was under a regime that was going to take 3 days of treatment every 3 weeks for 2 years in order to be able to be in this process or this system, this treatment that offered the best opportunity. And it was being paid for, since it was experimental, by NIH. And they paid for probably the first 4 months that I was in that particular regime. And after that, it had demonstrated some success, and they stopped the payments. But for all the other families, they didn't have the kind of health insurance that that had. It was $3,000 for every family every 3 weeks. And I listened to these families who's had their children had the same kind of affliction that my child had. And they said, look, we've sold our house. We have the $30,000. We have $20,000. We're able to afford it for 3 months, for 4 months, for 5 months. What kind of chance does my child have to be able to survive? I knew that my child was going to have the best because I had the health insurance of the United States Senate. And I knew that no one, no parent in that hospital had the kind of coverage that I had. That kind of choice for any parent in this country is absolutely unacceptable and wrong, my friends. And I can tell you this. When every member of the United States Senate comes in and signs into the United States Senate, they sign a little card in two places. And one is their signature for their salary, and the other is for their health insurance. Their health insurance. Now, Senator Brown of Ohio, to his credit, will not accept it until the people of Ohio get it. Every other member of the United States Senate, every other member of the United States Senate has accepted it. And for the 15 times that I have fought on the floor of the United States Senate that we ought to have universal comprehensive coverage, and to listen to those voices on the other side that have universal and comprehensive coverage and say, no, it is not time. We can't afford it. It's the wrong bill at the wrong time. My friends, if that health insurance is good enough for the members of the Congress of the United States, it's good enough for the President of the United States, it's good enough for everybody in Montgomery County, everyone in Pennsylvania, and everyone across this country.
Tonight we continue Senator Kennedy's lifelong mission. Our message to Congress is this. Millions of people, our family members, neighbors, co-workers, friends, and many of us are suffering from the current broken healthcare system. It's estimated that 22,000 Americans die every year because they don't have adequate health insurance. Roughly 690,000 Americans faced foreclosure last year because of the skyrocketing costs of healthcare and health insurance. These are not just numbers. This debate is about real people. And we can't afford to wait any longer for healthcare with a real public health insurance option. So now we're going to join with hundreds of other vigils across the country and read out loud some of the names and experiences of our fellow Americans, stories that were collected by MoveOn over the past week, in honor of all those who are suffering under the weight of our current system and who can't afford to wait any longer for real reform. We're also going to hear from a handful of people from our own New York City community who have stories to share of their experience with our broken healthcare system.
I'll get a new hip when I turn 65 if we still have Medicare. Kevin's health insurance denied him rehabilitation services he needed for a severe brain injury. Michelle needs an MRI but has no health insurance, so will have to pay about $4,000 out of pocket. Ron lost his life savings in the first month of hospitalization after being hit by a drunk driver. Fernando missed so much work because of the pain from his fibromyalgia that he was fired and now no longer has insurance to help pay for his medications. Faye is an unemployed recent college grad with no health insurance and epilepsy. Susan had to choose between putting food on the table and paying her health insurance premiums. Ted was a young father of a newborn baby who died while lawyers fought the insurance company to allow a bone marrow transplant. Eric is a father of two whose lack of health insurance kept him from getting a prompt cancer diagnosis or the best treatment possible. Mark and his wife are in their 70s and were dropped from their health insurance when the factory Mark worked for 40 years closed. Pam has MS, and she cannot get insurance coverage, so she goes without medical care. Joel and his wife both work, but are living near the poverty level. They lost their home, and now Joel has to choose which medicines he will not take. Cecilia has a brain tumor and doesn't have any health insurance.